In this module, we will be talking about median nerve variations. Upon completion of this module, the students will be able to recognize anatomical variations of the median nerve, to compare variations of the median nerve to the normal course of the nerve, to understand how the median nerve variations may impact an ultrasound image, and to understand how the variants of the median nerve could affect carpal tunnel syndrome. So here are the variations of the median nerve that we will be going over in this module. We will begin by talking about the palmar cutaneous branch variations, then we'll talk about the recurrent motor branch variations, and then we'll talk about the high bifurcation of the median nerve and communications that may arise in the forearm. So here we will talk about the palmar cutaneous branch variations of the median nerve. The two that we will talk about are palmar cutaneous detrans ligamentous, which pierces the transverse ligament, and then when the palmar cutaneous branch courses ulnar to the median nerve. So if we look on the picture to the right, this is a normal presentation of the palmar cutaneous branch of the nerve. It normally arises from the radial border of the median nerve, 5 to 6 centimeters proximal to the wrist crease. And as it transverses the wrist, it remains superficial to the transverse carpal ligament, passing between the superficial and deep layers of forearm fascia. So you could see that it's passing superficial to the transverse carpal ligament in this picture on the right. And so if we look in the picture of the left, we have the transligamentous branch, so it is piercing the transverse carpal ligament. And then the palmar cutaneous, when it courses ulnar to the median nerve, instead of passing radial, it would just pass ulnar. So here we will talk about the variations of the motor branch of the median nerve. So we have three of these variations that we will be talking about. The first is the most common, the extraligamentous takeoff, happening in about 46 to 90% of the population. We could see this in the picture to the left, where the motor branch arises from the median nerve distal to the transverse carpal ligament on the radial side. And then in the middle picture, we have the subligamentous takeoff, which happens in about 33% of the population, in which the motor branch arises within the carpal tunnel. And then the last one we will be talking about is the transligamentous takeoff, which happens in about 25% of the population. And in this case, the motor branch pierces the transverse carpal ligament. So next we will be talking about the high bifurcation median nerve, which is also known as a bifid median nerve. This happens in approximately 1 to 3% of the population. The picture to the right is normal, so the median nerve should normally go under the carpal tunnel as one nerve. But in the case of a high bifurcation median nerve, it bifurcates just proximal to the carpal tunnel, so it passes underneath as two nerves. So we could see in the picture to the most left that you could see a bifurcation just proximal to the carpal tunnel. And then in the middle picture, we could see that two nerves are passing under the carpal tunnel. So these are both examples of a high bifurcation median nerve. And then here is an ultrasound image of a high bifurcation median nerve. So we could see that to the left, there is one nerve circled, and that is a median nerve. And then to the right, there's another nerve circled right next to that nerve, and that is also the median nerve. So again, in this case, there are actually two median nerves passing under the carpal tunnel.
Here we see a picture of a bifid median nerve that we actually found in one of our subjects. So right here is one of them, and right next to it is the other of the bifid median nerve. So we labeled it, but here are the two sections, and they're divided in the middle.
So another variation of the median nerve are there could be communications between the ulnar and the median nerve. So the Martin-Gruber anastomosis happens in about 6 to 31% of the population. And this is when there's a communication between the median and ulnar nerve. And this can result in a varied pattern of innervation to the intrinsic muscles of the hand. So in this case, the median nerve communicates with the ulnar nerve. And you could see this in the picture to the right, that there's a little branch communicating the median nerve to the ulnar nerve. And then listed below, extremely rare, it's called a Murray-Nasse communicator. It is pretty much known also as a reverse Martin-Gruber because in this case, the ulnar nerve would communicate to the median nerve. But this is very rare. So now we will talk about the persistent median artery. So this is found in about 10% of the population. And what happens is typically the ulnar artery and radial artery are supplying the blood to the hand. The ulnar artery would travel alongside the ulnar nerve and it will form the superficial palmar arc. And the radial artery would form the deep palmar arc. But in the case of the persistent median artery, it could actually supply blood to the hand as well. So there are two types. There's the antebrachial, which it just supplies the median nerve, but it does not reach the hand. And then there's a palmar variation, in which the persistent median artery does contribute to the blood supply of the hand. In this case, it may contribute to the formation of the superficial palmar arc. So it would have a superficial course as the median artery travels alongside the median nerve and it passes close to the transverse carpal ligament. In this case, the persistent median artery will also travel or remain close to the palmaris longus tendon. And then the importance of this is that if the median artery is passing under the carpal tunnel, that is more that can cause compression within the carpal tunnel. So it could be an important role in the presence of the symptoms and presentations of carpal tunnel. Okay, so we are done with Module 7. So if you could please go back to the website and click on the quiz tab and take the quiz for Module 7 before moving on to the next module, that would be great. Thank you.